Collecting sexual orientation and gender identity data in healthcare settings is essential to providing high-quality, patient-centered care to LGBT individuals, as well as an important part of efforts to better understand and address LGBT population health disparities. Most electronic health record systems do not support the collection of structured sexual orientation or gender identity data, which directly impacts LGBT people through lack of data recording. This invisibility masks disparities and impedes the provision of important healthcare services for LGBT individuals, such as appropriate preventative screenings, assessments of risk for HIV and other STIs, and effective interventions for mental and behavioral health concerns, particularly those that may be related to experiences of anti-LGBT discrimination. Providing patients with opportunities to share information about their sexual orientation and gender identity in a welcoming environment facilitates important conversations with clinicians who are in a position to significantly promote these patients' optimal health and well-being. It is important to note that many transgender people do not identify as transgender. For example, a person who was assigned male at birth, but whose current gender identity is female, may choose female rather than transgender. Asking about sex assigned at birth as well as current gender identity provides better, more clinically relevant data and offers a clearer picture of the patient's identity and clinical needs. As such, gender identity collection should involve both of these concepts. So as you can see on this slide, the first question pertains to a client's current gender identity, giving the option to select male or female, or coming out and identifying themselves as transgender or genderqueer, or also providing an opportunity to assign a different gender category. Meanwhile, the second question allows clinicians to see that this person may be transgender, and allows the patient to also opt out of the question, giving full range of comfortability for the patient in the healthcare setting. This two-step question was developed by the Finway Institute in their Do Ask, Do Tell toolkit, and you can find the link in the bottom left. Furthermore, as noted in our Setting the Space presentation, asking for a client's pronouns and preferred name will also help in facilitating more positive client-provider interactions when coupled with proper staff training. The current ADAP Data Report Instruction Manual from 2015 includes provisions for including transgender and sex at birth data. The instruction, and I will quote, asks ADAPs to record transgender and sex at birth data by instructing that they indicate the client's current gender, the socially and psychologically constructed, understood, and interpreted set of characteristics that describe the current sexual identity of an individual based on his or her self-report. Gender cannot be missing. One of the few options below must be reported for current gender. First, male, which is defined as an individual with strong and persistent identification with the male sex. Female, an individual with strong and persistent identification with the female sex. Transgender, an individual whose gender identity is not congruent with his or her biological gender, regardless of the status of surgical and hormonal gender reassignment processes. Sometimes the term is used as an umbrella term from encompassing transsexuals, transvestites, cross-dressers, and others. The term transgender refers to a continuum of gender expressions, identities, and roles which expand the current dominant cultural values of what it means to be male or female. And finally, unknown, which indicates the client's gender category is unknown or was not reported. And for sex at birth, the ADR instruction manual provides a following instruction. Transgender, if the client is reported as transgender in the previous question, what the ADAP case manager must indicate the following: whether the person is male to female, female to male, or unknown.